I think school districts in Colorado should be participating in the School Health Services program and participating with the consortium, because districts that work with the consortium receive a lot more support and training and guidance, advocacy services, and they have also benefited by receiving about 20% more revenue than districts that don't work with the consortium.
The School Health Services program reimburses districts for the health services that they already provide to students.
Well, Medicaid in general and school-based Medicaid is a very complicated program, to say the least. We really see the value at Denver Public Schools being a member of the consortium to really help us navigate the complexities of Medicaid and school Medicaid.
The consortium has toolkits, training videos, our online Easy Ed Med support. We have things to help make this program less complicated.
When you have somebody like the consortium on your side who knows the system and can help educate you, it can only make things better.
Reimbursement has increased dramatically over the last couple years. It's increased by more than 50%. The impact of that is there's more money going back to the health needs of all kids in Colorado.
Working with the Colorado School Medicaid Consortium, we've been able to about double our income in the past 5 years.
Over the last 15 years, $100 million has come into this state for additional health services for kids through this program, through the consortium. $100 million.
You know, we're in a climate right now of decreased funding for K-12 education. Along comes a program like School Medicaid. We are now bringing in more money than we've ever brought in.
There's many different things districts can do with this money. It really varies from district to district.
We actually were able to hire more staff. Our nurses were able to get cell phones. They're going to have direct access to their schools immediately.
So it has been additional equipment. It has been additional outreach and enrollment services.
Jefferson County Public Schools saw hundreds of kids get access to eye exams and eyeglasses.
I think the sky's the limit when you give a child the opportunity to achieve their potential.
Those are things that are happening every day in this program.
You know, healthy kids are better learners. And not only are they better learners in the school setting, but they're going to just lead happier lives.
There's 3 major components of this program, and they're all very important components. You have to do everything well in each part.
School districts participate effectively by having the appropriate people on their time study and by training those participants who are on the time study to answer their questions effectively and truthfully.
By completing this survey, you're helping to bring in more money, more resources for kids.
The next part is the cost report.
It's really based off salaries and benefits of those providers who are providing these services to these children.
We now take all of the costs of health-related providers and determine what percentage of their costs are going to be reimbursed to the school district. And then the third piece is actually service documentation and claiming. You still need to document all the services that you're providing. How well school districts do in this whole 3-part process determines how much money that school district will bring in. And that's extremely important because in Colorado, there is no state funding that is designated directly for health services for kids.
Working professionally with the consortium, they really know what they're doing. They have all of the latest information.
We only focus on this program. That's our job. That's our expertise. We work with the Colorado Department of Education. We work with healthcare policy and financing, and we share that information back with our districts. We're passionate about helping children learn, be more successful, to have all the same chances in life as everybody else. We're making a big difference in not only children's lives, families' lives, but in the whole economy of Colorado. When we have children that are able to benefit from their education, they're going to go on and they're going to do great things. When you see the difference it makes for kids, you know, you just want to help school districts do better and better because you know it's how important it is to the most important people, and that's the children.